Okay, thank you so much, everyone, for tuning in for another episode of Telehealth Failure Secrets to Success. And today we actually really privileged to have Kristi Henderson joining us. And just to share openly, so normally when we do this webinar, we have about, roughly about 500 people who sign up each time. But with Kristi, I think we got close to 1,000 people sign up for today. So I think you're going to really enjoy what she has to share. Again, she's so famous within the telehealth industry in there. And I guess as we start, one thing that many of you probably all know her professional reputation, but some things you may not have known. Kristi, she's an avid runner. She runs like 5 miles a day and just super, super healthy. And I guess Kristi, as we start, maybe we could start with like maybe you could just tell us like how did you get into the telehealth space? Like how did you just maybe just go back into your career? Just how do you came to?
Yeah. So, well, first of all, thank you for having me. I really appreciate it. I have been working in telehealth since the late 90s. So in 1999, it was truly just a concept and an idea of how to solve a problem. So myself and several other colleagues really just sat around a table trying to address access to care and challenges with the health of the state where I lived at that time. And so we developed a program and started that as a pilot and took quite some time to be able to develop the idea into something that medical boards and nursing boards and others would support. But it worked, and it worked very well. And so in the early 2000s, started that program purely to address an access to care issue, and then evolved it. At that time, I had been working in an academic medical center and a trauma center. So I was running the ER as a nursing director. And so we were challenged every day with backlogs in the waiting room and people having to travel long distances to get health care, very similar to many areas across the country and internationally as well. And so we solved it with technology. We brought the healthcare to the individuals, and it worked, and then we spread it from there.
Oh, awesome in there. How about Kristi? Then, if you were to go back earlier careers, like you were direct to the ER. What did you do even before then? Like how did your career came to that point?
Yeah, so I'm a nurse by training and have always had a career in emergency medicine. So have been practicing in that area and in urgent care centers all of my career, and then became a nurse practitioner. So I'm a family and acute care nurse practitioner. So still practice in those same settings, and so was dealing with really the most vulnerable population in an area of urgent need around immediate care needs. And so it evolved from there, took leadership positions, and stayed clinical throughout most of my career until now transitioning over to Ascension Health, where I have an administrative role leading virtual care and innovation here in the Texas ministry. So it's all been an evolution, and interestingly, it always was trying to challenge the health system to take on a new approach. And so whether it was a new workforce and really trying to spearhead and lead the use of advanced practice nurses, nurse practitioners, PAs, and others that weren't fully integrated into the health system, or if it was to the other side, using and integrating technology into the system to try to look at a more efficient operation that could be scaled and reach more people with good outcomes. And so all of this has really led to everything building every experience one on another, and didn't realize how much my nurse practitioner experience would be important in this work, as well as the collaboration and team approach to healthcare is so important, and telemedicine allows that to happen.
Okay, awesome in there. I guess what we're going to do is, Kristi, we'll turn over. Maybe you can give us your presentation, share that. After that, we'll open up to the audience for their questions.
Yeah, absolutely. So I'm going to focus really on what I think about 2018 and kind of go through some highlights of that. So let me make sure you can see my slides, and then, okay, can you see them now?
Yeah, I can see the slide.
Okay, great. Okay, so I'm gonna jump in. So, I would say that for us, many of us who have been in the digital health space and have been integrating technology for a long time, when you look back in hindsight and look where you have come, it's so much progress. We have a long way to go, but one thing is that acceptance of digital health has dramatically increased, and for a lot of different reasons. But I would say that digital health is here to stay. There's not the question of is it safe or should we use it? It's how do I use it? How do I make it sustainable? And how do I really integrate it into the system of care? We've really moved across this whole technology innovation curve or pathway to get to this acceptance. So we had this trigger of here's a new technology that we can use in healthcare, and went around and probably had some disillusionment where we thought it could do more than it did, or we thought it was going to be adopted quicker than it was, or wouldn't have the challenges around reimbursement that it does. And so then it kind of came through to a realization of just past the probably unrealistic expectations to some more of a realistic view of how technology can play into healthcare. And so we've passed that into we're now into this phase of enlightenment. Okay, we get it. We trust the technology. We see how it can be used. Consumers want to use it. And so I'd say that it's here to stay. It's no longer being looked at as the black sheep in the crowd. It is truly here to stay. And now systems are really thinking, that mobile healthcare is healthcare. And so it'll be exciting to see systems and payers and other healthcare providers really rethinking how they do their work. And so the technology has been there. This was never an issue around technology. It's definitely gotten better and less expensive so we can scale it. It's really been around integration and workflow transformation and a trust that had to come. And so it's here to stay. So it's exciting to think about where we're going to go from there. I'd also say, too, that there's now enough literature and publications and research that has shown the positive outcomes, whether that's positive outcomes clinically or around access to care or around the value that it brings to a system, that now people are saying, okay, they're letting go. They're not pushing back, and they're saying, okay, let's try it. Let's put it in our strategic plan. Let's implement this in a smart way. And so health systems and providers are using it in a much broader way. It's exciting to think about that we're truly revolutionizing how someone accesses care, how they access health care, as well as when they access it and where they access it. Those limitations are not there anymore. And we all knew that intellectually. But I think that there's this aha moment of enlightenment to truly know, okay, wait a minute, I really can integrate this into my entire operating model of healthcare, which is exciting to think about. This increased comfort and trust. I used to get the standard of, that's nice, that's really cool, but my doctors or nurses aren't going to use it, and the patients don't want that. And we're past that. There's a balance of in-person care and the use of digital health that has to exist. And I think people are becoming more comfortable in leading more with digital health. So that's exciting. The consumers are responding so positively and really driving a lot of what we do now as there's this consumerization of healthcare. I think that what we're going to see over this year is a real focus on the integration. If you think about when we implemented electronic medical records, people held on to their paper charts, kicking and screaming, please don't take it away. And then there were incentives or penalties around not using it. And so it became kind of forced on a lot, and now it is mainstream. Telehealth doesn't have that same pressure, except that as we're looking at value-based care, there's really, I don't know how you reach value-based care without delivering care when and where people need it in the most cost-effective way, never sacrificing quality or the standard of care. But this is really going to be a year focused on integration into the workflow, approaching different hospitals or clinics, practice groups, whoever it may be that's delivering health services, and say, think about what you do and what has to be face-to-face where there's touching or a procedure being done, and what can be done through digital health. And so operationalizing that and putting that support around digital health services like telemedicine is critical to get integration. And so a lot around workforce, workflow analysis, and really creating a natural flow to using virtual care, so it's not seen as another, you shouldn't have to think to be able to get access to virtual care. If I call to get an appointment with my healthcare provider, I want to be offered that through virtual care or in person. And so this is going to be a year of a full integration and deployment in a more streamlined approach around healthcare delivery, so that it's not a separate department, but it's just how healthcare, one more modality of how to deliver healthcare. We have never really seen the full benefit of what is possible with virtual care. And so it's going to be a year of unleashing that full potential and really realizing, how can it impact access to care? What can it mean for care management or even empowerment of individuals to manage their own health through apps and sensors and other devices like that? And so as it's fully deployed and as we have a better ability to analyze the data to know control groups and comparing those that got care through virtual care and those that get it in person and look at that over a longer period of time, we'll be able to see the true impact to the total cost of care, which is going to be really exciting to see. And I think that before, because it was a pilot or because it was not fully integrated, it was always hard to get real good data analysis to look at that full potential and the impact on the whole system, as well as to the cost of care. We had a lot of barriers to being able to look at that return on investment. We may deliver access to care through telemedicine that was once not available, that then ultimately prevents an ER visit. Well, avoided cost is not looked at the same as revenue. And so really being able to start looking at that in a value-based model is exciting to think about. And so I think we're going to start seeing more of the full potential of a digitally enabled health system start to show some outcomes that are going to help us understand how to use it. When I think about what's happening in the market and across the country around healthcare, it's exciting and scary all at the same time that the competitive landscape is changing. There's new entrants into healthcare. Before it was the traditional health systems, retail clinics, federally qualified health centers, these traditional health sites of service or sites of care. And now we have new entrants into the system. And so we're going to see a rapid acceleration because there's competition. And with competition, hopefully all boats are rising and we'll start seeing new things happen. The other piece is that with all the mergers and acquisitions that are happening across the country, where not only is healthcare partnering with other systems, but across sectors. And so non-healthcare entities, private and public sector, whether that is a company that is a pharmacy or an insurance company or something else like that, that changes the players and the power of the players in the healthcare arena. And so that's exciting to think about and thinking, if I'm going to deliver care to a population, where is my weakness and who should I partner with to be able to achieve better care in a smarter way? And so as we think about healthcare systems partnering with non-healthcare entities, it's exciting to see what's going to happen there. So there's a lot of new players. The consumers are driving change too. So it's not just a change in the environment of healthcare because of new partnerships between health systems and payers or whatever. It is consumers saying, wait a minute, I trust this technology. This is what I want to use. I want to use my phone. And so as that pressure, and they're seeking that out, leaving their traditional healthcare providers to go to somebody that will provide healthcare in person or through virtual care. So we're going to see that pressure influencing decisions that health systems make as well as providers who really want to be on the cutting edge to differentiate themselves in the market. And, the other big piece is that all of us in this space have been working on so hard is around the policy and the regulations that influence how we can deliver healthcare, how we can get reimbursed for healthcare delivered through virtual care, and who can deliver care where. So I think as those continue to advance, we're going to see this accelerate even more. But so many of those barriers have cleared. If I think back to 1999 and the barriers that we had then and now, I would say I don't have any barriers. It's really just about persistence and delivery and execution. But there's still work to be done on the policy side, but you'll see that influencing a lot of what we do as value-based care and macro and some other things like that continue to move forward. Virtual care will be a key component of that. So then I was sitting there thinking about, what am I really excited about in 2018? Virtual care is not new. Telemedicine, digital clinics through your phone, remote monitoring and sensors aren't new. I do think there's some really exciting applications and ways to use that our system was just not ready for before, or consumers weren't ready for, that we'll see. But if I think about some of the ones I'm most excited about, the use of sensors and remote monitoring is incredibly exciting to think about how I can manage the health of the population that I serve in the most convenient way and is ubiquitous as possible, so that as a patient or an individual is going through their life, I'm picking up data points that are helping me know if they're getting sick before they even know if they're sick, or what I can do to intervene to keep them healthy and well, so that it's more of a prevention instead of a reaction when they're showing up in an ER. It's very exciting to think about it in really trying to help seniors live longer at home independently, all the way over to, of course, the chronic disease management challenge and crisis that we have across the country. Augmented intelligence, I like to say augmented, so that it's really augmenting our healthcare team and our systems. The possibilities there of increasing productivity and improving accuracy with machine learning and other things are phenomenal, scary and phenomenal all at the same time. So it'll be exciting to be a part of creating what that looks like in the future, so that we know that healthcare is safe and this is maximized to help our system deliver better care and have better outcomes. The work in facial recognition has a lot of uses that I'm excited about. Everything from quicker registration to be able to get an appointment or be admitted to the hospital, over to really assessing different indicators for certain mental health or neurological conditions, so that I can have subtle cues maybe that there's issues with depression or dementia or other things that I can then intervene on. And then you can think about it all the way over to the side of some of the challenges we have around insurance fraud and abuse. So with facial recognition, that really addresses a key component of that challenge that we're dealing with. And then I put, of course, telehealth, and I put telehealth instead of telemedicine just because I think there's going to be an increased use in our additional services, not from just our providers, of our physicians and nurse practitioners and PAs and pharmacists, but really around dietitians and health coaches and rehab, OT, PT, speech therapy. I think that regulatory changes are advancing to allow them to really advance their specialty and their services through virtual care. And so telehealth will be exciting for 2018. Precision medicine, I probably don't have to say too much, but it's all about data. And if we know more about an individual and can customize care to be right for the individual, then we have better outcomes. So that's an exciting space with some of the genomics and pharmacogenomics that are available now. Socially intelligent robots. How do we think about automation in healthcare? Every other sector of the world is using automation. Where do socially intelligent robots fit in? And how do we make sure and balance that human touch, that ability to discern and really have emotion? So that'll be exciting to see. I've started some research in that space and excited to think about the possibilities there to really allow our clinical teams to focus on the patients and get rid of tasks that are not necessary for an individual to do. The list of others so long that I'm just going to highlight a few because I know we want to get to just kind of a Q&A portion of this to really dig into what people have on their minds. But this is where everything from blockchain and fintech and bitcoins and some of the augmented reality of the heads-up devices and things that are really going to transform healthcare and even the financial model of healthcare. And so things like Li-Fi or the light-based wireless connections that have data speed so much faster. If you think about the possibilities with that and what it means for virtual objects and virtual reality, there's really no end in sight here. And so I think the exciting part of that is what we can build and how we can improve health in a whole different way. The challenge will be to do that in a socially responsible and safe way. So that'll be exciting. I think we'll push the envelope and we'll probably see it come back after some regulations come around that. And so that I'll end with a slide around what I put on kind of my watch list for 2018. What am I thinking about? There's all these exciting new things that I want to implement and use, but then there's also some things that I'm got to watch because it may have me pivot or adjust my strategy. Cybersecurity is on the forefront of everybody's mind. It's not when you're going to have a breach. It's not if you're going to have a breach. It is when you're going to have a breach. And so how do we think about that with virtual care and how do we safeguard ourselves for that? The impact of net neutrality, we don't know fully what that means yet, so we need to keep our eyes on that to understand how it will impact virtual care. FDA regulations on digital health, still more to come on that as well, but looking to really have an easier way to be able to implement innovative products, and so some exciting things happening there. When you think about even the European Union data protection regulations, in just over 100 days, that's going to go into effect and have that enforced. And it's really a goal to make sure that data privacy is maintained across all of Europe to protect citizens' data. So that'll be interesting to see how that may influence other things across the world. The ONC's pending definitions of data blocking and OIG's kickoff of enforcement of that, what all that means, we just got to keep our eyes on that. And then I can't end without speaking about data analytics and how much that's going to play into everything we do, not just around what I mentioned earlier around precision medicine, but really around value-based care and around really redesigning our model of care and rethinking healthcare based on data. So it's exciting to think about that. I think it'll be a priority for all of us. There'll be a lot of investment in that, sharing of data, and how do I make smart decisions. And so 2018 is going to be an exciting year, and I'm looking forward to all of this and more. So I'll pause and we can open it up for questions.
Awesome, Kristi. Thank you so much. Again, so for the audience members, so I think Kristi has just a wisdom of knowledge in everything telehealth. You should feel free to just ask her anything. Again, to ask the question I queue up, maybe I could start a question, Kristi. So right now, I guess on the legislative front, the whole ACA with the President Trump, there seems to be a lot of turmoil in there. I mean, what are some of maybe your personal prediction, like what will happen? Will the market stabilize? What will happen?
Well, if I could answer what's going to happen with ACA, I'll probably I'll have a whole change in my future. So, I don't know. I mean, I know that what I do know is that virtual care is supported and is a bipartisan issue, and it addresses the needs of so many of our challenges in healthcare and our financial crisis around healthcare. And so when you go to Congress and you are on the Hill testifying and communicating the stories around how virtual care is addressing access to care, care coordination, vulnerable populations, whether that's mental health crisis in our country or it's around rare diseases and clinical trials or whatever it may be, virtual care plays into that. And so the exciting piece is that whichever direction the ACA takes us, virtual care is going to be a component of that. How we are going to ever achieve value-based care without it, I do not know. However, how a physician could manage a population and of patients without virtual care and meet macro needs and all the care coordination challenges. I just don't know how that can be done without it. So that's exciting. I don't know where the future goes, but what I know is either way it bifurcates, virtual care is a piece of that.
Got it. Great. So we have a question from the audience, Renee. So she's asking, so what do you recommend as the minimum qualifications for therapists for providing telepsychotherapy?
So let me clarify. It's the question around what do I think is a minimum requirement for the providers that are delivering that service? Yeah. So, I think that if we look at virtual care as a modality of care, the requirements of an individual to provide a certain service in healthcare are established by their governing boards, whether that's nursing, medical boards, physical therapy, whoever it may be. All of those associations and boards are guiding that. And so I wouldn't deviate from that. However, what I do think virtual care allows us to do is make sure that we have everybody practicing to the top of their license. So I don't have to have a psychiatrist doing all of that. We need therapists, we need psychiatric social workers, we need all of this team, but the interconnected nature of what we can do with virtual care is so empowering for a successful outcome for patients. And so I would say that in addition to just meeting the making sure you have the license necessary to do the service that you want to deliver, having some basic training around virtual care, it's so easy. That's the great part. We all are used to, we're doing it right now, teleconferencing. I think that the challenges around making sure that everything's firewalled and safe and HIPAA compliant, and making sure that you think through web etiquette around making sure eye contact and lighting is right, and things that are really the same things we teach healthcare teams when they deliver in-person care. There's a person on the other side of this camera, and then how do you maintain that relationship and that integrity to that relationship through video? And that is a special skill set, but one that people pick up very quickly because they're using this technology for even non-healthcare services.
Got it. Kristi, do you have like a general rule of thumb guidance? Suppose you have a therapist we practice and they want to move to like how much training, like how many hours do you recommend? Do you feel like, since you'll become pretty confident, like?
Yeah, I think everybody approaches this a little different. There are formal training classes across the country. There's some educational centers that actually incorporate training, so somebody could go for a couple days and learn telemedicine 101 and etiquette. I try to integrate it into an orientation process that any healthcare provider or new employee would have in the healthcare system, so that it is truly another tool in their toolbox. And so they do their regular job, but they can deliver it through this mechanism. We do customize that to some level. So if, for instance, a dermatologist wants his or her practice to come on using telemedicine, we have to understand what their clinical needs are so that we make sure we have the right technology. So do they need a derm camera? Can it be just face-to-face? Does it need to be a higher resolution camera? So those things are part of that orientation, but it's not long. It's truly, we've downloaded what you need on your computer because we want them to do this wherever they are. It shouldn't have to tie the provider down to a certain location either. So we make sure they understand that. They understand how to document this work that they do, understand billing and reimbursement implications of it. And that can be done in just a few hours.
Got it. Okay, great. So I have a question from the audience, Melinda. So she's asking, within telehealth, you could do sort of synchronous, like video, telephone, you could also do this sort of asynchronous, monitoring. And they're like, do you have a sense that is the synchronous more important, or is the asynchronous more important?
Well, where it all started was in synchronous. One, there wasn't a trust factor to virtual care. And so it had, in many states, it had to be the equivalent of face-to-face, and you had to have the video component to it. And that doesn't mean that asynchronous can't have video to it as well. So it can be both. I think the interesting thing is that asynchronous interactions with patients has occurred since the beginning of healthcare. People left messages, I need this, I have these symptoms, and there was this communication back and forth. And portals is an asynchronous communication between patients and their providers. You know, I think that that'll grow more and more. The hardest part with all of that is if you have all this data coming in and these stored visits over here. So maybe you have 3 or 4 patients sending in information asynchronously, which become new visits for you for the day. So you've had, you know, your 30 patients for the day, and then all of a sudden you've got another pile of them in your inbox to handle on an asynchronous basis. So it's really, again, around integration into your workflow and making sure you allot time for this, because these are visits just like in your regular office. And, you know, I think that the piece about that is where you see providers not wanting to adopt it because we haven't integrated it into in their operations in a fair way. I mean, how can we expect them to just 24 hours work because it will pile up? So thinking about that when you implement asynchronous is important. How do you operationalize that and sustain it? But I think that asynchronous is going to grow.
Great. Okay, got it. So I have a question from Richard. So he's asking, so if you provide, as a physician, is there, you know, telemedicine regulated by the state, right? You have to have license in the state for the patients. Okay. What about in terms of like the therapists, you know, like marriage counselor, those things, are they governed by sort of the state regulations, like you have to have license in the state, or can you just do across all state lines?
Yeah, all right. So every profession has different rules about that, but every state does as well. So whether they fall under the Department of Health or some other board, that has to be looked at on a state-by-state basis to understand that, and then understand the certification and licensure scope of practice for each individual, and counselors is different in every state as well. So that brings a lot of complexity to using virtual care. If you're looking at implementing this on a national level, you truly have to understand those unique differences state to state. So there's the federal governance from whatever regulatory board represents them, then there's state requirements. There may even be facility requirements as well. So if you work for a health system, they may further restrict it or may keep it to its broadest sense in the state. So those are 3 critical areas to look into when you're deploying telehealth for whether it's physicians or a therapist.
Got it. Thank you. So we have a question from audience from Rojang. So he's asking, what about in terms of using robots to do things sort of physical support? You know, what are some exciting development you have seen, I guess?
So, okay, I can speak to a study I did last year and one we're broaching for this year. So the focus was really around as patients are getting sicker and sicker in our hospitals, and our staff, whether it's nurses or whoever, has a more complex population to take care of. There's a lot of tasks like fetching and gathering. There's a lot of looking for certain pieces of equipment. There's all kinds of things that I wanted to explore. How could a robot help me with this? And so we actually had some researchers come in who had a socially intelligent robot, but had them actually follow staff around and ask them these questions. Let me just watch you and see what's happening on a day, night, evening, weekends, and see what your challenges are and see what are the low-hanging fruit around what a robot could do for you to make your life easier. And so, you know, for years, we've had things delivering pharmaceuticals and meal trays and things that are robotic. But, you know, more of if a patient's admitted for a certain diagnosis, you know, you have a high probability of knowing what kinds of supplies they need, at what frequency they need them. And so how can we do better supply management fetching and gathering, and even wayfinding in hospitals. It's pretty cumbersome going through a health system. So I think there's a lot on operational efficiency and even interacting with patients directly. I did not go into any of the robotics where robots were going into patient rooms, but you could easily, refill water bottles. You could bring linens in. There's all kinds of things that could be done. I'm just on the tip of the iceberg. There's several other facilities that are doing similar research as well, trying to think differently about robotics and what's the balance between the human touch and where automation can play into healthcare.
Got it. So I guess, Kristi, one of my concerns is, right, so now that healthcare is the largest employer sector in America in there, so if people worry about that if you have too much robots, it will take away people's jobs. Do you see, is there a certain area where robot could be very helpful in the healthcare setting, at the same time it doesn't take away like people's jobs?
Yeah, okay. So I think that's, I'm so glad you brought this up. So think about, I think it's the first or second largest, highest number of jobs are drivers across the country, drivers. So if you think about driving cars, what does that do now to our taxi industry and our drivers? Same thing. So, I don't know the answer to this, but just yesterday I was talking to a lot of our leaders here thinking about, I need new skill sets. I need, there's more work that needs to be done than ever before. So the workload has increased for an individual. So how can I make sure each individual is doing the things where I really need them focused, that really takes a unique skill set and discernment and emotion and all kinds of things that a robot isn't able to do? How can it augment? And matter of fact, I joked and said, can I put the things I hate doing in my job on a list and give that to a robot? I think our workforce is going to change. I think we do have to diversify our talents and make sure that we remain valuable and needed. Robots hopefully will just pull off and augment our efficiency and quality of life. We all work really hard. How can robots balance that and make us healthier as well in a work-life balance? So more to come on that one.
Yeah, I would love to collaborate. In fact, at the ATA this year, you're going to see some robot inside our booth. In fact, we're exploring some of these, the whole idea, how to make the robot so low cost, then you take the cost out of the equation. Then how can you use that as a way to augment the workflow? But I think the issues we want to solve is just really at the end of the day, is we do want everybody to have a great job, high paying job, so have maybe almost do what you mentioned, maybe the things you don't want to do, then give it to the robots.
It almost becomes a robots as a service model. So that could be interesting. That's going to be fun to watch.
Okay. And we have a question from the audience, CG. So she's asking, in terms of reimbursement, in California, still seems to be the biggest barrier to telehealth. You have many, still have insurance company. They'll say they will allow telehealth, but they're not willing to pay for it unless you're meet a rural area, various things. What are some maybe your thoughts on how to get around that, to getting just all these payers to fully pay?
Yeah. Okay. So it's that I'm not going to minimize the challenge there. Insurance payers like CMS and Medicare have a huge impact on the speed at which this grows. When I started this and when many of us did, there was no reimbursement at all. And so it was often funded by grants. And so there's, I think, nothing worse than starting a great service and having to take it away from the people you serve because the grant ended. And so building sustainable business models that assume the reality, which is reimbursement is not there fully. Where I am now in Austin, Texas, none of the areas that we serve are truly designated as rural areas. Where I came from before was a state where almost all the state was considered rural. So I had more reimbursement mechanisms there. Your business model needs to have multiple different streams of revenue so that if one's impacted, the other one can help balance that out. But I'll tell you, payers are coming to the table now. They're very interested in talking about how to deploy this where they have a high need. And so I would challenge you to go sit down with your payers and have that conversation. Where are your members as an insurance company? Where do you have challenges? And let me tell you how we can solve that for you. I think the biggest component to a successful negotiation around this is to show how this service is substitutive and not additive. And so the total cost to the insurance company should come down. And be willing, if you're confident in your program, be willing to go in and go at risk for that and just say, you know what, I'm so confident, let's change the payment model of this so that we benefit once we show that savings. So I think that you'll have to go out and take some risk. I think that having those conversations and being willing to commit to not being additive to the system is important. No one wants a transactional telemedicine visit that's just another cost to the system.
Got it. So we have a question from the audience from Matt. So he's asking, so what are your thoughts as for your organization? Like, you think about using telehealth as a follow-up communication after the patient discharge or leave a clinic?
Yeah, so we're using it across the whole continuum of care. And so if a good example is in the perioperative experience, so a patient needs surgery, we're using it on the front end for pre-op of patients all the way to follow up with patients after their surgery. One of our most exciting programs is our whole care coordination program, where we're interacting with patients outside of the system. And so whether that's outside of the clinic, outside of the hospital, understanding the needs of our patients and building technology solutions that are very simple and not too heavy for a patient. So if you have a patient that is post-surgical, you don't need to call them every day for 3 weeks if everything's going fine. And so making sure you use data and patient information around their symptoms and where they are and what their needs are to really meet them where they are. But we're doing an enormous amount of work in that whole care, post-transitions of care after they leave a hospital or clinic and supporting patients in the home through sensors, through apps, through remote monitoring kits, and the like. So really seeing a great response. What's interesting is comparing the groups that we do care coordination with, the compliance or the engagement of patients when we use tablets with video enabled, or if we just do phone management. There's about a 20 to 30 or so % increase in compliance when you use the video application. And so a lot of people think people don't want to do video, they'd rather just talk on the phone. And in some cases that's true, but what we're seeing consistently now is a relationship and an accountability that comes in when we have a face-to-face conversation with somebody that's resulting in good compliance.
Okay, great. So how do you pay for, are these something like that, like the CMS pay for that, do the payer pay for that, or like?
Yeah, every state's different on commercial payers, but Medicare does pay for it. And if you haven't seen the new remote monitoring codes that were effective January 1, it's worth looking at. But there are a couple different ways you can get paid for this, whether that's through CCM coding or care coordination management codes from Medicare, or now through the Medicare remote monitoring codes. There is a mechanism for reimbursement. And then your other third-party payers are all, you have to go and negotiate that and make sure you contract with them for that. There are codes out there. You just have to make sure your contract with the payers incorporates that.
Okay, great. So I have a question from Nina. So she's asking, do you have any tips, recommendations for introducing telehealth to these older population who might not be comfortable with technology?
Yeah, so, I think it's no different than in person. So if I am the nurse taking care of a patient that leaves the hospital, I adjust that education to the health literacy level, to the age of the patient, how they like to receive information, and to make sure it's culturally sensitive as well. So it's no different deploying telehealth or telemedicine to a senior population. It is intimidating to some of them, the technology, but it just takes a little bit more time, and we're not having that challenge. Matter of fact, once they are confident in it, they're so excited to have somebody to be able to interact with, and that socialization that can come for many of them who may be alone at home has proven to be actually a motive for them to connect with us and want to use the video. So I would just say adjusting and being patient and making sure your technology is one that is adjust for seniors. So, the colors that you use, the size of the font, and even implementing audio instead of them having to read in case their vision's not as good. So there's a lot of ways you can adjust to be able to accommodate their needs, but we haven't seen a problem when we implemented that.
Okay, great. Okay, I have a question from Johnny. So he's asking, so he's a compound pharmacist. So he's looking to collaborate with physicians to expand their sort of telemedicine practice, from working with the EDs, health and wellness market. I guess his question is more maybe of like a startup type of question, like what are some suggestions for how does he go find out more of these people he can go collaborate with?
Yeah, so the first thing that comes to my mind, there's a lot of different ways you can approach that. But if you're thinking about it from bringing your pharmaceutical expertise to health systems and providers to really be a true part of the team and collaborate and provide information, then I think that you'll probably have the earliest success in practices that are a part of a accountable care organization or some that are at risk for their population. As we all know, one of the number one reasons for readmissions into the hospital are a pharmaceutical or a medication management issue. Mm-hmm. And so I can tell you that I've incorporated pharmacists into our care coordination and remote monitoring program because when patients leave the hospital and they have questions, the majority of those questions are about medications. Some around just as simple as I can't get my medicine, but oftentimes it's questions about, can I take this medicine with food or with this other medicine, or or maybe they have the same medicine provided by two different physicians, and so they need somebody to do a med reconciliation. And so we're using pharmacists through a telepharmacy program to do med reconciliations on all of our admissions to our hospitals, but we're also using them to handle all of our pharmaceutical and med management questions after people leave the hospital. So if you think about it in those contexts, you could provide your services to hospitals, you could provide your services to physician groups, and there's a huge thirst for that because we know it's such a big culprit for people's health declining and readmissions to the hospital.
Yeah, that makes sense. So I have another question from Robert. Okay, this is also maybe along like a startup type of question. So he's asking, so he want to approach healthcare system hospitals to add in a service line, like telehealth services to them. And so where do you start? Like, do you approach the chief medical officer? Do you approach the IT, and also like how do you get the insurance company to sort of get on board and pay for it? Okay,
so it depends on what service line it is. It's always good to come at your approach with a business plan that shows the need. Even if it's a great idea, if you're not solving a problem, this is not a day and age where there's extra revenue sitting around in health systems. They're very lean budgets, and the decisions that they're making to partner and start new projects are all very laser focused. And have to be able to show a return and address a problem that they're challenged with. Mm-hmm. And so if it's a service line and specialty, say something around cardiology, there's a lot of focus around heart failure and heart failure readmissions to the hospital. And so I think that you need to make sure you're aware of the challenges in the health system that you're approaching and even the health of the community. So doing that community assessment to say, okay, in this zip code, it's got the highest rate of attention deficit disorder and the highest use of ADHD medications. And so then if your solution is around combating that and addressing that, then you can start showing your business case and the return on investment that the system may have. You know, I would tend to always go toward the clinical side and the executive team with a proposal to try to get in front of the leadership team to pitch your case. That's not easy to do. And so having a champion inside the system to partner with you to bring that forward is important. So it's all about relationships and understanding the business case and why it matters to the people you're pitching to. So that's where I would start.
Got it. Thanks for that. So we have a question from Chris. So he's asking is how are like clinical like labs, these addresses using telehealth? For example, you want to collect from doing like blood pressure, urine sample, blood works, weight in there. Like
how are we doing clinical labs through telemedicine? Is that what you're saying, or how are we partnering the
correct? Is there like do you send the nurse to the home visit to collect the sample? Like what are some best practices to actually deal with it?
Okay, so you know what you do on your smartphone is limited unless you have other diagnostic tools. And so whether that's, you know, plug in stethoscopes and echoes and whatever else we can do with this ultrasound. I mean, you have a lot of capabilities, but no one has that at their fingertips. And one of the other limitations to your smartphone being a much broader use is not having access to labs. And so a lot of people have done this in different ways. It may be that I would say the majority are probably, if it needs lab or x-ray, then a lot of times they're converting that visit and redirecting that person to in-person care. In the more advanced telemedicine programs, they are saying, hey, I need you to have some blood work done. I want you to go, here's the closest lab to you. I've already put the order into that lab. Go get that done in the outpatient lab. And then they'll send me the results, and then we'll schedule a follow-up in, you know, the next 3 or 4 hours. We can review the results of that and can complete that visit. That is not happening as much because the coordination of that can be difficult. There are technology platforms out there that allow that to be a component of the virtual visit. So if I had a virtual visit, I could send the patient an order and that they could have on their phone that has a QR code so that when they go into the lab can scan that, pull up the order, know exactly what to do. And so that helps facilitate that. So some people are converting it to in-person visits. Some are partnering with labs to be able to do that. And then the third one is what you mentioned, which is the deployment of somebody to the home. And so we're really not doing a ton of that at all. I do have a group that had been going to do home visits with our most vulnerable. So maybe they couldn't get to us, they didn't have transportation, or maybe they were even homeless and we were going to see them out where they reside in the community. So we have the mechanism to do that. I would say that more people are partnering with community paramedics and deploying them to homes, or either partnering with home health companies to make that an extension of their program. So I think the sky's the limit on that. I think you can do it in phased approaches. So it may be that you provide the virtual care and then partner with a retail clinic that's in your area in case you do need this, and then they can complete the visit. There's a lot of ways to do that, and I would say it really needs to be based on the community, the other resources that are available, and the sophistication of your virtual care program.
Got it, great. We have another question from the audience, Jason. So he's asking, so typically as soon as you're dealing with EMR, you just become very slow because those things is just complicated to deal with. So how important is to have your telehealth tool to integrate it with your EMR, or it's okay to leave them semi-separate?
Yeah. All right. So if you talk to the providers, they want it integrated because it's easier. So if I'm in my electronic medical record, I do everything there. My schedule's there. I click on that patient and that opens the record. And then if I have to minimize that and throw a video up in another portal that has a different password, that becomes a little friction that sometimes can result in it not being adopted as much. Saying that, many health systems, large ones especially, are still dealing with multiple electronic medical records. So I know we have really 2 main ones, but 4 are utilized across our system here, just in our across our hospitals. And so our providers are used to going in and out of multiple different EMRs. And so if I integrate, I'd have to integrate into a lot of different ones, and then that becomes can become cost prohibitive. So we've chosen to keep it separate. And then now we always document in our native EMR. So I don't want to change that. I don't want to make my providers document in another EMR or an EMR associated with a telemedicine application. But that's not how everyone's approaching it. I think that's why there's all these different options, is because one may work for one health system and another for another. So understanding the barriers or friction that you might come into for any of those will help you make your decision. I just wanted it to be as simple as possible for everybody, so I chose to do mine separate from my EMR.
Got it. Really appreciate that. Again, so we're coming to the end of the hour. We have, unfortunately, we have a bunch of questions. I apologize for the audience we couldn't get to. But one thing we will do is we'll send these questions to Kristi, so we'll post the answers on the recording archive afterwards. Again, I think Kristi is such demand. We just have so many questions. We literally just couldn't get to everyone. One thing Kristi asked, we maybe wrap up, if I may just quickly ask you just 3 quick questions. The first one is like, you share many insight today. If the audience could just take one thing away, learn one thing from you today, what would be that one thing?
That virtual care and mobile health is healthcare. Don't look at it as anything separate. Don't make barriers that aren't there. This is a modality to deliver healthcare. So anybody in your system, they ought to rethink what they do on a day-to-day basis to see how they can implement it into their work to improve the health of the people that they serve and make their operations more efficient. This is no longer a side project. This is how we deliver healthcare.
Great. Another question is, so what is this like the one thing that you believe in telehealth that no one else believes in yet?
I think that, I don't know that no one else believes this, but I think that we are underappreciating the impact and the disruption that is about to occur in the healthcare ecosystem. And that is not just from technology. That's going to be a huge driver from the financial side of it to the clinical delivery. But I think that the mergers and acquisitions and the partnerships and the new entrance into this, into healthcare is going to change everything as we know it. The rules of how we had to do certain things are kind of getting blown up, and those barriers are going away, and people are working around the barriers that were causing them not to be able to deliver healthcare through virtual care. So I think we're going to have a much bigger disruption than we anticipate.
Got it. That makes sense. Then the final question is, so if you can whisper one idea into President Trump's ear, like about healthcare, what would be this one thing you want to influence?
You would end on that one. You know what? All I need is 5 minutes. We really have virtual care is a solution. It's bipartisan. The barriers need to be cleared so it can the benefits can be fully realized, and so that people will truly integrate it into operations. It is truly being delayed only because people can't figure out how to get reimbursed for it and how it fits into the system of care. This really solves so many of his issues when it comes to healthcare and the cost of healthcare. So I would really want to provide a blueprint of how we can do this. We can change healthcare for the U.S. with virtual care.
Great. Okay. Thank you so much, Kristi, for the. Okay. Thank you. Bring up the final announcement page. Okay. Maybe watch it again. So, Kristi, thank you so much for spending an hour with us and sharing insight. Really, really appreciate your wisdom. Like I said, you're literally our celebrity. You broke our registration record. Again, thank you so much. Okay, so maybe as we wrap the announcement there, so one thing is we plan to have Um, we plan to have our our ATA exhibit. We're looking for partners. We can sort of exhibit inside the VSee booth. Again, VSee will have the largest booth of the entire show. We actually have a sort of interesting partner. We could collaborate on marketing and so on. Then we also starting a machine learning, artificial intelligence competition in Vietnam. So if you're interested into whether be a sponsor, a judge, or even be have problem set, definitely let us know. We're starting a competition actually next month. It's going to run for 6 months in there. And then we also have our telemedicine boat and motorcycle and backpack design competition. Again, if you're interested in participate in that, definitely let us know. And finally, we're still doing a lot of work writing the blueprint for a new way to do medical insurance as a way to lower the cost by half. If you're interested in collaborating with us, definitely contact us. Again, thank you so much for joining us this week.